How are you doing today? Good afternoon. I am Dr. Yuen in Edinburgh, Texas. We are located here in 3802 South Highway Business 281 in Edinburgh. And welcome to the call. If you, by the way, if you catch this one in the replays, give us your comments. I would like to answer your comments and have a very good communication with you. And please, if you find any value in this one, please share this. We're going to talk about or interview Dr. Velez. He is an endodontist in the town. Every time we have any dental referral, any problem with the pain in the tooth, we refer with Dr. Velez and his group. He's a group here in Edinburgh, and he has another office in Harlingen. And we have another group that we also refer, but we have the honor today to have Dr. Velez with an interview, and he will give us something that a lot of people has questions, and he will answer some questions that you may have also. And this is a good time to learn about Dr. Velez. He is graduated from San Antonio, and he is very experienced. I honor him and admire him. And we're going to present Dr. Velez today.
Hi, Dr. Lee. It's a pleasure for me to be with you this evening. And I will share with you, with the people, some simple questions about what endodontics and what we can do to save teeth. So, in general terms, endodontics deals with the saving of teeth, and normally we can do two things with teeth that have problems. When you have pain, infections, and other kind of diseases, you can pull the tooth and you get rid of the problem, or you can save it, if it's savable, by doing a root canal treatment. And a root canal treatment is something simple in today's day with the technology that we have available. So normally something that was very painful in the past, with the new advances in the technology and aesthetics and different approaches, we can save teeth without being involved in a lot of hassles or problems.
So you recommend to save the tooth instead of pulling the tooth, right?
Yes, when we have an infection or a big abscess, if you remove the etiology by removing the whole tooth, then you can get rid of the infection. But we discovered a few years ago through the research and investigations that if you pull only the tissue inside the tooth, you can still save the tooth and be functional and keep the tooth in your arch and keep it for function.
Functional, right?
And if that happens, then you will be happy because you can keep the physiology, you can keep that function, and you can keep your smile.
Mm-hmm.
And it's for both aesthetical reasons and functional reasons that we try to save the teeth.
Tell me in a very quick way, how do you do your root canal, if it's possible?
Well, root canal is something that we do when we have, for example, in this model, we have a decayed tooth, and normally with this decayed structure, we have to remove that decay, and most of the time when we remove that decay, we will expose the nerve that is inside, or we call it the pulp. Mm-hmm. When we have that exposure, and if you leave it there and restore it, it will be very painful. So through different researches and through different techniques, dentists discovered that if we remove the whole tissue inside, clean and shape properly those canals, and then seal them up, we can still keep the tooth in function, as we said.
Mm-hmm.
So we access the tooth through the top of the molar in the molar or the posterior teeth, or through the back of the tooth if it is an anterior tooth. We just do that and insert files, and by inserting files we remove, tear down each one of those cells or tissue that is inside, and we clean and shape those canals as thorough as possible, and then we seal them up to assure that blood and body fluid will not go inside the canals. So this is a very nice way to save the function, as I said, of the tooth and keep the aesthetic of the tooth in the arch.
Wow, thank you, Dr. Velez, for your information. So after the root canal, we recommend also to...
well, once the root canal is complete and the system is healthy again, by debriding the system and sealing it properly, we recommend to crown the tooth. A crown is also called a cap, and those crowns can be done by your general dentist with different materials. It can be with metal, usually gold. It can be alloys of different metals. In today's with today's technology, you guys are using porcelain. You are using a new technique that is called CEREC.
Right.
By the way, you did very one in my mouth, and it was great.
It's still there?
It is still there. It's still functional,
goodness.
and I still have time for it.
Hey, man.
That's good. So these crowns can be different, as I said, different colors. Normally, today we have good materials that are mimic the color of the tooth and the function of the tooth in a very aesthetically acceptable way to replace those decayed structures.
Thank you very much, Dr. Velez, for all your information, and hopefully we can have more questions, and we can just bring you back, or any other doctors can come and give us more information. Thank you for your time.
Oh, thank you, Dr. Lee, and we are very happy to share with you this evening.
Thank you. Then, if you have any questions, give us any comments, and we will answer you in the future. Thank you. Have a good day. Ahora vamos a hacerlo en español.
It's off, right?
Hopefully, no,